Today's webinar will focus on the working group's recently released document, Malaria Social and Behavior Change Guidance in the Context of the COVID-19 Pandemic. We will begin with an overview presentation on the document, followed by a discussion on the current experiences people have in Malaria SBC implementation, and time for any questions or comments on the guidance. Before we begin, I would like to share a few housekeeping announcements. Please note that as a participant, your microphone is automatically muted for the presentation. If you have questions for the presenters, I encourage you to submit your questions and comments using the chat box, and I will collect them for the presenters to answer after the presentation. During the second half of the call, participant microphones will be enabled for the discussion. We ask that you use the raise hand function, as you can see here, and we will then enable your mic. You can access the raise hand function by clicking on the participants box at the bottom of your screen and selecting the blue hand icon, or type into the chat box and indicate that you would like to share a comment. Additionally, please keep your webcam disabled as it may affect the bandwidth for some participants, so we will only have the presenters sharing their webcam today. And finally, please be advised that we are recording the session and that both the presentation and the recording will be made available following the webinar. If you do not currently receive our emails, we will share a link in the chat box where you can subscribe to our mailing list. With that, it is my pleasure to introduce you to the presenters on today's call. We are thrilled to be joined by 3 members of our working group steering committee and the principal authors of this new guidance. Anna McCartney-Melstead is a malaria technical advisor at the Johns Hopkins Center for Communication Programs. Shelby Cash is a malaria technical advisor for the President's Malaria Initiative at the U.S. Centers for Disease Control. And Andrew Thompson is a senior malaria technical advisor at Population Services International. Anna, Shelby, and Andrew, thank you for joining us today. And Anna, I will hand it over to you to get us started.
Fantastic. Thank you so much, Priya. And welcome to everybody. What a great group we have so far, nearly 80 participants. Can I just make sure everyone can hear me okay? You just let me know in the chat box. Okay, great. Thanks, Bridget. Priya, can you give us the next slide, please? So I don't have to tell everybody what a strange time this is right now. This is an extremely strange time. You know, for the past few months, not just the malaria community, but the public health community, the world at large has been dealing with COVID-19. And as the malaria community, one of the first reactions that we had when this pandemic started was, how do we make sure that the deaths from malaria don't skyrocket in the midst of all of the COVID restrictions, rules, and regulations? And there was a real need, and an immediate need, from the folks at the country level and the community level to get some guidance on how exactly their interventions should be changed and tailored to both meet the needs of maintaining our gains in malaria that we've made over the past decade plus, which have been phenomenal, and also ensuring that we do not become vectors of the COVID-19 threats, protecting our staff, our volunteers, and at the same time, you know, so there's a lot of considerations that needed to be made. The world came together at this point. WHO, along with PMI, experts from across organizations, came together and developed guidance for countries, NMCPs and others to use as they worked through how to continue malaria services in their countries. And there was a number of work streams. One of the work streams came up with some guidance on tailoring the malaria interventions in general in your countries. And that really spanned all of the different types of you know, interventions, from LLINs to SMC to IPTEP. And SBC, as we know, is a crucial part for any malaria program. So our working group was tasked with making sure that that guidance document that came from this group of international experts had a complementary SBC focused document. And so that's what we're talking about today. But this was really a reaction and, a call from the international community to make sure that SBC was being represented. There are a number of other COVID and malaria documents that provide guidance to countries on more specific malaria issues. AMP, the Alliance for Malaria Prevention, has done a lot of work on the ITN's campaigns and distribution and COVID recommendations, and there are some SBC recommendations in there, which we were a part of helping draft, so there is continuity across these documents. UNICEF and the WHO have come out with this community-based healthcare in the context of COVID. There's an SMC document that is under development now. There's many others as well. So just to say, this is one piece in a sea of recommendations and guidance documents that we know is very specific. It's the niche of our working group, and we really hope that it is a useful tool. And we're also using this platform to make sure that we continually update this document to reflect realities on the ground. So a few key points about this document. Like I said at the beginning, this is an unprecedented time. There's never been anything like this in recent history that we can compare this to. There are people that talk about Ebola and the similarities and differences between Ebola. We can take quite a few of those learnings. But what we know is this is an unprecedented time. The goalposts are changing, but malaria remains an issue and needs as much attention as we can give it. And so one recommendation, the kind of core recommendation that has come out, is considering all of the complexities with developing country health systems. Given the complexities of the COVID disease itself, which seems to, we learn more and more about it every day. The interim guidance is that community level SBC activities conducted just for the sole purpose of promoting uptake of malaria interventions should be temporarily curtailed in favor of other SBC interventions such as mass media, mid-media, digital, social media approaches. And of course, like with everything, this is context specific. Some countries are opening up more, some are allowing larger groups of people, but I think that it's really important, to underline that the safety of everybody is of paramount concern. However, there are specific activities such as IRS, SMC, LLIN campaigns, where community activities can be considered and should be considered due to the return on investment in OA, due to the ways in which these interventions are going to greatly help the malaria situation, but only after careful consideration of the guidelines, discussions, and really making sure everyone's on the same page with everyone's safety. And to mention again that this guidance is evolving. We are looking to you to make sure that we understand what's going on the ground as well, so we can adapt the guidance as needed. And so we're really looking to you. We're going to be talking about this guidance today, but we want to hear back from you as well. So there are several key considerations when thinking about doing malaria SBC in the COVID context. I mentioned earlier about a specific community SBC, but in general, if we take a step back, we need to be thinking about channel selection. Given how terribly infectious COVID is, what channels are going to reach the audience with the messages that you need? Maybe we should be thinking about investing more in mass media or mid-media, or digital instead of house-to-house visits, for example, just an example. Another consideration is now is the time to innovate, and we must adapt these activities. And so now is the time to innovate and get creative in ways that maybe we haven't been pushed to do so before. You know, the world is rapidly changing technologically. There are new approaches, there are new ways in which to reach people, and you know, I think that now is an opportunity for us to look into those different types of innovations. Consideration 3 is about rumors and rumor management. This is key in the COVID-19 context for COVID itself, but there is also a lot of emphasis on how malaria and COVID rumors can be intermixed. And this is just kind of the reality of health systems, and when people who don't have a lot of information or who have incorrect information, you know, struggle with knowing what is the truth and what is not the truth. And so this is a consideration as well. Stigma is something that we have learned very well from Ebola. Stigma against not only the people infected with COVID, but the healthcare workers who treat those who have COVID can really impact people's care-seeking attitudes, going to the clinic, getting tested for malaria or getting tested for a fever could actually end up in a very different situation if you don't have COVID, but rather you have malaria. So stigma is something that we need to be very, very careful of, and I'll be addressing as early as possible. There are a lot of gender dynamics that we need to think of, especially with quarantines and sheltering in place. You know, women's roles in the homes can be, you know, the domestic abuse situation can be escalated. Women's roles in the homes can be, you know, greatly impacted with more and more family members in the home. Gender is an important consideration. Another consideration we briefly touch on in this guidance is about chloroquine, hydroxychloroquine, Artemisia. You know, the chloroquine issue 4 weeks ago was maybe more of an issue than it is today. And so that actually speaks to the guidance that this is an ongoing and updatable guidance that we are talking about. And, you know, as these new issues, such as the Artemisia connection are coming up, it gives us an opportunity to address them. You know, and then also a reminder about the importance of context. The global guidance doesn't necessarily, it is global in general for a reason. But of course, every country has their own context, and there are complications, and there are, you know, just the idea of everybody having access to PPE, for example. We know even in the United States, that's an issue. So the reality check needs to be a part of everybody's SPC plans as well. So I won't go through all of these behaviors, but these are the key behaviors that we need to think about when we are planning for our SBC in this context. And we've broken them into provider behaviors and beneficiary behaviors. And so given this context of COVID, there are infection prevention measures that need to be considered, and adherence to guidelines, to the national guidelines for malaria case management. Some countries may have some changing case management guidelines, and making sure that the providers are up to date and adhering to those guidelines are very important as well. You know, the infection prevention and control is not only for providers, it's also for beneficiaries. And then we have the same malaria behaviors that we encourage end users and the people at large to be practicing every day and routinely. Just to mention a little bit about kind of what makes this this guidance, well, it's special in that it's an SBC focused guidance document, but instead of just kind of a how to, you know, do this, don't do this, we really encourage those to look into the determinants behind these specific behaviors. You know, there's cognitive, social, and emotional, determinants, things that are these behavioral determinants that are likely to influence the uptake of a particular behavior. And so we know that knowledge is one part of behavior change, but it's only one part of behavior change. And there can be far more influential behavioral determinants than knowledge itself. And so we should not lose sight of that in this time of COVID. So I think at this point, I'm going to hand it off to Shelby, and we're going to have a discussion later in the call, so you'll see my face again. Thank you.
Thank you so much, Anna. I'm really looking forward to today's discussion. As Anna said, we really look at this opportunity as a chance to also hear from those of you that are on the ground and dealing with the changing context on a daily basis. So we really look forward to that. So the response to the COVID-19 pandemic must utilize and strengthen the infrastructure that has helped health programs to address malaria and other infectious diseases around the world. And if supported, these health systems will help to curb the impact of the COVID-19 pandemic and maintain the essential health services. However, if the systems and the staff are not well engaged, then the gains that we've made in saving lives from malaria and other diseases over the past 20 years may be lost. Thus, national and local programs should continue to provide service delivery interventions for malaria, even with the risk of transmission of COVID. To that end, I would like to highlight a few of the key service delivery related behaviors and SBC programmatic recommendations that we have included in the guidance. The behaviors and the recommendations that I will highlight today were selected based on questions, challenges, concerns, and initial feedback that we've received from implementing partners, NMCP staff, other groups that have been working to mobilize and address malaria issues related to the current context, and some of our PMI in-country teams. And so it's our hope that these highlighted behaviors and recommendations can help to spur additional discussion at the end of the presentation. So the SPC guidance affirms the importance of a key malaria behavior, continuing prompt care seeking for fever, with the target audience being community members. However, the guidance goes further to suggest that special emphasis be placed on encouraging those groups that are most at risk for malaria, for example, pregnant women and children under 5, to seek care within 24 hours of fever onset. And while the RBM SBC working group recognizes that malaria risk remains high among all community members, our goal with this first recommended approach is to better align our messaging with the key population's level of risk and mirror an approach that we've successfully used in messaging for other interventions, namely ITN use. And so as we all know, prompt care seeking facilitates prompt diagnosis and treatment and reduces the likelihood of severe illness, particularly within these key populations. The second recommendation to facilitate the promotion of prompt care seeking is to develop and adapt messaging that describes the client's role in protecting the health of everyone at the health facility. Everyone has an essential role to play in slowing the spread of the new coronavirus. However, the good news is that with small changes in personal behavior, we can help to protect everyone within the health facility by reducing potential exposure. To that end, messaging should describe the limited movement of clients within the health facility to reduce potential COVID infection. Messaging should also describe the importance of clients practicing infection prevention and control behaviors, such as frequent hand washing, covering their mouth when sneezing or coughing, and physical distancing before, during, and after being seen by a provider. And finally, as facilities ensure that policies and practices are in place to minimize exposures to COVID-19, various measures may be implemented before patient arrival, upon arrival, throughout the duration of the client's visit, and until client areas are cleaned and disinfected. Some of these measures will be new for those seeking care at a facility, so it's important that they know what to expect so they are less likely to be deterred. As such, adapted care-seeking messages should incorporate communication on any changes to patient flow to triage those suspected of COVID-19, and it should also describe why there may be longer wait lines, longer lines that appear longer due to more spacing between patients and clients. And then finally, messaging should include communication related to any task shifting to the caregiver. For example, a mother may be asked to lift the clothing of a child or administer treatment with close provider observation. So to build upon the highlighted behaviors from the previous slide, the guidance stresses infection prevention and control as a key behavior that should be practiced by community members seeking care. And these recommendations will help to create an environment at the health facility where patients and clients feel more comfortable seeking care. First, facilities should place hand washing or hand sanitizing stations at entrances to the health facility, along with cues to action or reminders placed throughout the health facility, as this really helps to facilitate the uptake of infection prevention and control. Furthermore, to continue to promote these behaviors, health facility staff should model what they expect clients to do. And as clients see this behavior being modeled, they're more likely to do the same, as this will become a norm within the health facility. This may also increase client belief that frequent hand washing, physical distancing, and using a mask or face covering is effective at limiting the spread of COVID-19, thus establishing health facilities as an enabling environment for continued prompt care seeking. Shifting the focus to health providers, it is imperative that proper case management guidelines are followed. And at the core of this behavior are key determinants such as knowledge, norms, and self-efficacy, which directly influence the extent to which providers adhere to such policies and procedures. For example, a health worker must first know the screening and testing guidelines for COVID and malaria. However, when we look beyond knowledge, SBC evidence suggests that providers who believe adherence to guidelines is a common practice or a norm amongst peers, they may be more likely to do the same. Moreover, if providers believe that they can follow both of the COVID-19 screening guidelines and continue to adhere to malaria guidelines, they may be more likely to continue to provide quality malaria diagnostic and treatment services and conduct appropriate differential diagnosis to address non-malaria causes of fever. With this in mind, the key recommendation is to promote the continued use of confirmatory testing at the facility and community levels. SBC implementers and service delivery partners should continue to promote the use of RDTs over microscopy to ensure efficiency and timeliness of diagnostic procedures according to the guidelines. Under normal circumstances, the management of fever cases includes a diagnostic test for confirmation of the malaria infection, followed by the recommended treatment. However, we certainly understand that exceptional circumstances may arise within the context of the COVID-19 pandemic, where reverting to presumptive treatment over fever with antimalarials may be the only available option. And in such instances or circumstances, national guidelines should be strictly followed. The last behavior and associated recommendations that I would like to highlight are related to service communication. Effective service communication can help improve provider-patient interactions, increase the adoption and maintenance of healthy malaria-related behaviors. It can also help to create a cycle of good provider-client relations and increase demand for and use of malaria control services. Now more than ever, providers at facility and community levels have an important role in continuing quality service communication. Quality service communication between the provider and client should focus on building trust, reducing fear, strengthening collaboration, and include counseling patients on prescribed malaria treatment, including the importance of adherence to treatment regimens. Moreover, providers at the facility and the community level should really capitalize on this time with patients to address concerns or misconceptions around COVID-19. And this includes addressing potential rumors or misconceptions for malaria within the COVID context. For example, how malaria and COVID-19 are transmitted. Service communication should also address the risks that are associated with delayed care seeking and specific practices being implemented at the health facility to minimize exposure to COVID-19 within the health facility. So in summary, the COVID-19 pandemic has certainly presented various challenges requiring flexibility on the part of ministries of health, donors, stakeholders, and implementing partners to really be innovative and adapting of malaria programming to local needs. And as we continue to exercise flexibility, we may be more likely to maintain our malaria prevention and treatment services, adapt to the changing behaviors and determinants, and continue overall operations. So at this time, I will hand it over to Andy, who will talk to us about malaria prevention interventions.
Thank you, Shelby. Good morning, good afternoon, and good evening, everyone. It's really a pleasure to be with you today. As Shelby mentioned, I'm going to speak very briefly about the working group's Malaria SBC recommendations for malaria prevention interventions in the context of COVID. So shifting gears a little bit towards interventions that are delivered in campaigns. For the sake of time and brevity, I'm going to focus on 5 key behaviors that are highlighted in the working group's guidance. For all cadres of providers, kind of picking up where Shelby left off, I'm going to speak a little bit more about conducting service communication and counseling for beneficiaries of these interventions. And then for beneficiaries, I'm going to focus on 4 key malaria prevention behaviors: ITN use, IRS acceptance, and SMC acceptance and adherence. So like I said, picking up where Shelby left off, I'm going to focus first on providers. And in this case, we're thinking of providers as people who are involved in the implementation of a campaign. So registration and distribution agents for ITN mass campaigns, spray operators for IRS campaigns, and distribution agents for SMC campaigns. And speak a little bit about their specific role in conducting service communication and counseling. This is really an interaction between the provider and the client, and it's critical during the COVID-19 pandemic. We're including this cadre or these cadres of providers in this guidance because given the restrictions in many countries to mitigate the spread of COVID, any one-on-one interaction between a provider or a Ministry of Health official and a client will be rare. And so we think it's really important to capitalize on any one-on-one interaction between a provider and client that may occur during COVID-19, including interactions between campaign agents and beneficiaries. So in the rare occasion there is an interaction between a provider and a client, the opportunity needs to be taken by the provider or campaign agents to communicate the importance of malaria prevention interventions during COVID. And it's important to keep in mind here that with our SBC activities and materials, we're really trying to motivate campaign agents to engage in service communication and counseling. We're trying to change the behavior of the provider to engage in these specific activities during their interactions with beneficiaries. And so as we're thinking about how to motivate campaign agents to conduct service communication and counseling with beneficiaries, given all of the other things that they have to do as they're implementing an ITN campaign or an IRS campaign or an SMC campaign, it's important to keep in mind that they might be more likely to conduct service communication if they themselves are knowledgeable about the importance of malaria prevention and care seeking during COVID. So keeping in mind the importance of the knowledge of campaign agents in their ability to deliver service communication and counseling to beneficiaries. Campaign agents may also be more likely to conduct service communication if they believe their peers are also conducting service communication and counseling during interactions with beneficiaries. So really thinking about social norms and perceptions of what others are doing during this time. And finally, campaign agents may be more likely to conduct service communication if they believe they have the self-efficacy, especially during this difficult time of COVID, to implement service communication and counseling with beneficiaries. So it's important that these factors are highlighted in our SBC activities and materials targeting campaign agents. And as Shelby mentioned, the working group is also recommending to highlight the importance of compassionate, respectful, and caring approaches during service communication and counseling. This is a really difficult time for everyone, And it's important, especially during this time, to maintain and continue respectful care during interactions between campaign agents and beneficiaries. Priya, the next slide. Switching gears a little bit to campaign beneficiaries themselves, I realize that it seems almost flippant to lump these really important and separate malaria prevention behaviors, ITN use, IRS acceptance, SMC acceptance, and adherence into one category, and to talk about them kind of categorically on one slide. However, from an SBC perspective, the working group believes that the determinants that are influencing these behaviors during COVID are similar. Essentially, if you think about it, for each of these behaviors, the malaria community at the national, regional, and local level is really asking the target audience, in this case, campaign beneficiaries, to weigh the risk of malaria to themselves or their family to the risk of COVID to themselves or their family. And so as such, we are recommending that the working group thinks that it's critical to kind of focus on campaign beneficiaries' perceived risk of malaria, perceptions of social norms, and response efficacy when trying to promote these critical malaria prevention behaviors. We believe that a campaign beneficiary may be more likely to use an ITN correctly and consistently, accept IRS, or accept and adhere to SMC if they perceive themselves or their family to be at risk of malaria during the COVID-19 pandemic. So through our SBC activities and materials, it's critical to highlight the risk of malaria that families are at during this COVID pandemic. They may also be more likely to use an ITN, accept IRS, or accept and adhere to SMC if they believe others in their community or social network are also practicing those behaviors in the context of COVID. So again, focusing on social norms, not glossing over the fact that people are influenced by their social networks and their communities, really capitalizing on that opportunity. And finally, campaign beneficiaries may be more likely to practice these malaria prevention behaviors if they believe practicing the behaviors will actually help prevent malaria. So focusing our SBC activities and materials on response efficacy of ITNs, IRS, and SMC during COVID. So in terms of SBC programmatic recommendations, the working group wants to highlight the importance of using every opportunity to remind campaign beneficiaries of the importance of these malaria prevention behaviors, especially in the context of COVID, and to include the reminder that these prevention behaviors are meant to reduce the number of fevers in the community, and that every fever that can be prevented is one less fever case for the health system to handle, which will help reduce the burden on the health system. So it's really critical, as we all know, that campaign beneficiaries continue to practice these malaria prevention behaviors. It's also important to highlight what is being done and what actions are being taken by campaign agents to help mitigate the spread of COVID during the implementation of campaign activities. And then also using resources that are available from other partners, and highlighting on the point that Anna made, during the implementation of any campaign, using any and all channel to monitor rumors and to address those rumors immediately in order to maintain a healthy stream of communication. And with that, I'm going to hand it back over to Anna for our discussion.
Thank you, Andy, and thank you, Shelby. That's so great. And I see a lot of excellent discussion already happening in the chat box. So a housekeeping note, Priya, do you want to talk us through the logistics for the discussion?
Sure. So just as a reminder to everybody, please keep your microphones muted unless you have been called on by Anna or one of the other presenters to share your comments. Perfect example. So we can hear what everyone is saying. So you can do so by clicking the raise your hand feature, which you will find under the participants button at the bottom of your screen, or notify us in the chat that you have a comment that you would like to share. And if you're having trouble with unmuting, you can also just share your comment or question in the chat, and we will try our best to address as many as we can.
Thank you so much, Priya. Yeah, like I mentioned, there are so many folks from different places on this call, and you know, of course we don't have the answers to all of the questions that are coming up, but I do like that there's already discussion organically happening in the chat box. And Valentina, very happy to have you on the call as well. We did mention the guidance earlier in the call, and I think that we'll put a link to the guidance that UNICEF had developed on community and ICCM, which is great. So I just did a quick survey, and it looks like we have folks from Ghana, Guinea, Nigeria, Uganda, Niger, Ethiopia, Tanzania, Cameroon, Kenya, Cote d'Ivoire, Senegal, Guyana, Zambia, Malawi, Zimbabwe, Burkina. And I just want to appreciate everyone jumping on this call today, because I think there's going to be a wealth of experiences that we can learn from. So as I mentioned at the beginning, part of this webinar is to hear from you folks on what kind of challenges and solutions have popped up. And so this first part will be us asking you your experience, and then we'll have a question and answer session after that. So if you can either raise your hand or in the chat box, let us know your experience. We are wondering, in general, how are national and subnational policies and guidance related to COVID-19 affecting your SBC implementation activities? We see that I think someone from Nigeria was talking about resource constrained settings, not having soap and things like this. But I think that there's probably a wide range of experiences. So if you want to share with the group, we would love to hear from you. How are national and subnational policies and guidance related to COVID affecting your activities at a country level or a community level? And a lot of questions coming up. I see Miko, thank you very much. Anyone have any experiences that they would like to share? Well, I know while people are thinking, I know that several countries have limitations on how large of groups they can accommodate in community settings, you know, bringing folks together, and that's making community dialogues and these things difficult, which I referenced earlier in the guidance. I see Tope has his hand raised. Tope?
Hi, Anna. Hi, everyone. Yeah, it's good to see you again, Anna. So yeah, for Nigeria, I'd just like to share our experience currently from the month of April, when we recorded the index case and all of that. All over the country, community level activities have indeed been suspended for now. The restrictions for the initial period were that all states across the country were locked down, so restrictions to movement applied across board. The number of cases that have been recorded per state have varied. And so we're beginning to see a scenario where states are beginning to open up based on the risk that they perceive and their ability to be able to manage the situation. So while in some states you still have total lockdowns, some other states you have lockdowns for a week with 2 days window where people can go out to, restock and all of that. So, but as far as community level activities for malaria has been concerned, there has been a total lockdown. There has been a pause in all activities for now. So what we're now experiencing is, for states where we're supposed to have LLIing campaigns, we still have a little bit of, kickback from the governments of some of those states, not wanting to ease there are restrictions with regards to, allowing people to gather at the community level. So part of the challenges we're now seeing is not even from the level of the community people. We're beginning to see a little bit of resistance from the government itself, not yet understanding the strong need for malaria activities and interventions to actually continue during this period. So there's now a need for us to begin to shift focus a little bit away from even the community response to, first of all, engaging with governments of these states, getting them to understand the importance of continuing with these interventions. Then at the facility level, because the response at the community level, especially with the frontline health workers, has not been as robust. We initially did not have community spread as much, but now what we find is health workers, getting COVID patients that present with malaria symptoms. And so the health workers, more of them are now getting infected. The communication to them for risk did not go out timely enough. And so it is just recently that, effort is being made by the national response to, focus attention on the frontline health workers, especially at the community level. So we're now seeing a situation where yes, there's a need to implement the malaria activities and interventions, but there's some sort of apprehension on the part of governments, and health workers are even beginning to abscond from some of the facilities because cases of health workers getting infected are now on the increase. So this is currently where we are, and focus is being made on, enlightening the health workers as well as the government to understand the importance of supporting this malaria intervention and allowing them to proceed. Over.
Thank you, Tope. Great, thank you so much. Sakonan Trari, did you have a contribution? Okay, Guda, did you want to say something?
Yes, thank you. Good morning and good afternoon, everyone. So just from Ethiopia experience, we have a community-based malaria communication activity, which is focusing demand creation for early line and sick treatment during fever or whatever at community level. So the intervention requires, interpersonal communication house to house to create the demand for early line utilization is the other one, and also mass gathering. But in Ethiopia, the restriction is just didn't allow, more than 4 people to gather. So this was the challenge. Originally, we planned accordingly, social gathering, social mobilization, interpersonal communication, house to house kind of visit. But considering, the restriction, we come up with modified SBC approach, just to look through, the social capital, what are the traditional, kind of networking or communication means. So there is a kind of village crisis at each village level. So we have tried to recruit them. They always, shouting. They do have, we call them Rumba Nafi, but they have the trumpet and they start to shout like starting from 5:30 a.m. They are individual, a person, so they respect, this social distancing, no problem with that one. So we came up, to see these social capitals leverage and tap this one, and we have trained close to 180, village criers. So they are very listened, attentively by the community early in the morning. So they start to shout about malaria messaging. Early in the morning, people are very curious for this one. It is a traditional one. So we are trying to modify this one. So these are the challenge and the solution shortly. Thank you.
Thank you. Thanks so much, Guda. So why don't we switch gears a little bit to our biggest fear. Are any countries experiencing that COVID-19 is affecting the uptake of malaria-related behaviors? Are fewer people coming for testing? Are more people coming for testing? For example, are the malaria-related behaviors changing due to the COVID-19? So, Sekonen, I see that you would like to speak French. Unfortunately, we don't have translation, but if you wanted to type in French, we could have someone translate that for you. Any countries experiencing a change yet that you know of, or even anecdotally of in the malaria-related behaviors? We've heard some countries struggling with people reporting to clinics for fever management.
Toi?
Okay, go ahead.
Voilà, donc merci beaucoup de me permettre de parler français. Donc, vous savez qu'au Burkina Faso, nous avons en majorité le français. Je suis très intéressé par vos webinaires. C'est pour ça que je suis en train de suivre. Je comprends quand vous présentez ou quand vous parlez, mais je ne pourrais pas dire ce que j'ai envie de dire en anglais totalement. Voilà, donc je pense chez nous, il y a le Covid. On a des cas au Burkina Faso, surtout à Ouagadougou, les grandes villes. Maintenant, le gouvernement a donné des restrictions par rapport aux activités pour le changement social et comportemental sur le terrain. Donc, aujourd'hui, il est un peu impossible pour nous de faire des activités de lutte contre le paludisme en regroupant beaucoup de gens. Voilà. Donc, la stratégie nationale actuelle qui est adoptée, c'est la stratégie de porte-à-porte. Et cette même stratégie de porte-à-porte réduit aussi le nombre de contacts. Voilà. Donc, on nous suggère sur le terrain pour les activités de communication de ne pas dépasser 25 personnes. 25 personnes en suivant bien sûr une grille bien spécifique parce qu'il faut aussi bien donner l'importance de l'utilisation des moustiquaires imprégnés, l'importance de l'hygiène du cadre de vie, l'importance de la prise de la chemoprevention saisonnière. Vous savez très bien que chez nous, nous faisons la CPS, qui est la chemoprevention saisonnière. Mais il faut aussi donner des informations sur les mesures de barrière contre le COVID-19, dont actuellement le gouvernement a mis à notre disposition. Moi, je suis par exemple au niveau de la région du centre-nord, précisément au niveau du district sanitaire de Bouchouma. Voilà, nous travaillons beaucoup avec les communautés. Nous travaillons aussi avec des organisations à base communautaire qui sont des partenaires très importants dans la lutte contre le paludisme. Donc, c'est les gens qui rentrent, qui vérifient vraiment l'utilisation des moustiquaires au niveau des domiciles. Et nous sortons, nous faisons les supervisions ensemble pour vraiment essayer de voir tout cela. Donc, voilà ce que je voulais dire. Au Burkina Faso, on a aussi la journée mondiale de lutte contre le paludisme le 25 avril parce qu'on n'a pas pu fêter, voilà, parce qu'il y a le Covid. Donc, il y a eu des messages clés qui ont été donnés en intégrant vraiment les mesures de barrière Covid. Voilà, c'est ce que je voulais ajouter de la part du Burkina Faso. Vraiment, merci beaucoup de m'avoir permis de parler en français. Merci.
Merci beaucoup.
Sorry. So this is Lamine calling from Guinea. So I wanted to share what we have done in Guinea since this pandemic started. So I think in Guinea, when the COVID-19 started, National Malaria Control Program in collaboration with all the partners has developed a risk mitigation plan linked to the pandemic. Now we have developed a various intervention in that plan, which align to the national response plan against COVID developed by the National Agency for Health Security. So we have in Guinea, we have National Agency for Health Security, which is in charge of COVID response. So if you look at the plan, the main objective of the plan is to contribute to reducing the effect of COVID-19 pandemic on the implementation of malaria control activities. So we have, looking at the plan, we have several activities which has been developed by the NMCP in collaboration with national with all the partners. So the strategy was developed, and which was being asked is that, and we asked the community health workers, to carry out awareness raising activities through regular home visits. So these awareness raising activities will be based on communication media, which will be developed and adapted into the context, in the COVID context. So we also talk about educational talk on preventing malaria in the context of COVID-19 pandemic. So I think one of the challenges that we are facing right now is because of the limitation of the movement. So right now, we have seen a reduction of health facility consultation, because even yesterday we had a call with our implementing partners. I think they have noticed that because of the limitation of movement, we are seeing the reduction of health facility frequentation. And the plan has been developed. For the time being, we are now discussing with Global Fund and National Control Program how to mobilize funding to implement what has been planned in the mitigation plan. Mm-hmm. So I wanted to highlight that one.
Yeah, no, that's great. Thank you so much. And I know that there are a number of other guidance documents that could be assistant you, especially when it comes to some of those finer details. Why don't we go ahead and I know there are tons of questions, and I know people have more questions than they do answers, but this next question might be more helpful to hear across experiences. What are some successes that you have had in adapting your malaria SBC activities in this context? We heard from Gouda that they've increased the use of town criers. That's one kind of success. What other solutions or successes can we hear about from our colleagues? If you do have questions, you can continue to type those in the box. We may not get to all the questions due to time, but we will be collecting them and addressing them and sending them back to this group. So, but in the meantime, please raise your hand if you have any successes or different approaches that you're trying that could be helpful for other countries. Taunga? Taunga, can you please unmute and then let us know? Okay, why don't we go to Joel while we wait for Taunga's sound to get sorted. Joel?
Thank you, Anna. So we are currently spraying in 8 districts in northern Uganda and part of the east. And what has been extremely helpful is working with religious leaders and school heads. For the religious leaders, we work with them to provide the compounds of the churches and mosques, whereby we can use them for the training of trainers and also for training of spray operators. And then for the school heads, same thing. They provide, because it's the current rainy season in Uganda, the school heads also provided space because all the schools are currently closed, so the buildings are empty. So they provided space which we can use for the training to take place. As you know, we are currently observing social distancing in the country, meaning at least minimum 2 meters apart between individuals. So we needed space where to work without problems with weather. So if the weather is good, they provided a compound, whereas if the weather is not good, they provided space inside the buildings. And the space has been big enough, so at least we've been training about 10 people per session. So we've been able to pass on the message from the training has been completed very well. plus also the community leaders who are passing the message in the village. So we have the same model, like which Guda mentioned, which has people moving with megaphone from place to place. So also those ones where we use the spaces at the religious places of worship and the schools to, you know, train them, like to pass on the message that should go down to the community in terms of opening the houses, which Andy talked about earlier, and also accepting IRS, and also knowing that this is safe even during COVID. So that's how it has worked. And so we combined those two, and our IRS is just moving smoothly right now. Thank you very much.
Yeah, that's great, Joel. Thank you so much. We see in the chat that some governments are using megaphones, religious leaders, as Joel mentioned, and school teachers or school heads and facilities is a solution. So we're going to go ahead and move to the last question in the interest of time, although this conversation could have been a 3-hour conversation. How can the RBM SBC working group provide additional resources and support? And do you have any resources to share? So please, in the chat box, as much as possible, put your questions, and you know, the steering committee can come together and try to generate some suggestions or throw it out to the larger audience on our Springboard page, which has all of our working group members. Maybe they can help troubleshoot across countries. And if you have any other resources to share, we would love to see those as well. Does anyone have any ideas? If you can raise your hand if you have an idea of how the working group can continue to support your work in the COVID-19 context. We would love to hear it. Otherwise, we'll ask you to keep typing in the chat box, and we'll compile all of these answers and responses together. And we wish we had more answers, but unfortunately, this is a case-by-case situation, it seems, and also you know, highly context specific, and with a disease, it seems to be changing in a lot of ways. Do we have anyone's hand raised? No? Okay. So we're going to leave this session open for a bit so you can continue to add your contributions, your resources. If you have materials, we would love to see the materials that you've developed in this context. And we are sorry that we're not able to make this a longer session. Maybe we need to have a part 2 sometime soon. But please make your contributions. And thank you so much for joining us today. On our part of the RBM Partnership to End Malaria SBC Working Group site, there are a number of resources that could be helpful for everyone, not just for the COVID-19 setting and developing your strategic plans, M&E plans. We encourage everyone to go to the website and access all of these documents. And we are a very open working group, so if you're not yet a member, we would love for you to join us.
Thank you, Anna. Thank you, everyone, for joining today. Since we are at time, we will wrap up. Please note that a recording of this webinar will be sent out to everybody, and the slides will be made available. And in that same email, we will include all of the links that have been shared today in the chat box. Thanks, everyone. Have a wonderful rest of your day.